Hey, are you okay? Call 911.
Today, our message is simple. We want to prevent heart disease by having you discuss your risk factors with your doctor. Things such as your family history, high blood pressure, overweight, tobacco use, diabetes, sedentary lifestyle, and even the use of hormones or birth control. Early heart attack care, or EHAC, just means recognizing that heart attacks have early beginnings. These beginnings can start hours, weeks, even months prior to the actual heart attack that brings people to the hospital. This can be broken down into classic or typical symptoms: chest pain or fullness in the center of the chest, shortness of breath, sweating, jaw pain, pain that travels down one or both arms, nausea, and vomiting. Women, diabetics, and elderly persons may experience the not-so-typical symptoms. These include excessive fatigue, heartburn, nausea, anxiety. It can even be pain in the upper abdomen or upper back. 85% of the damage occurs to the heart within the first 2 hours. We ask that each of you partner with us for the EHAC prevention. If you recognize these symptoms early, see your physician or your cardiologist to make sure these are not your heart. If you recognize the symptoms and need to come to the hospital, we ask that you call 911. Do not drive. We want you to arrive alive. EMS can administer life-saving measures such as oxygen, starting an IV, and giving you heart medications prior to arriving to the hospital. They'll also send us an EKG so we can activate the cath lab and the cardiologist to meet you here. Time is muscle and every minute counts. If you miss the early signs and someone collapses, call 911 and perform hands-only CPR until help arrives. There's only 3 easy steps.
Hey, are you okay? Call 911.
First, you'll check the person by tapping them to make sure they're not responsive. Then call 911 to get help. Next, compress by interlocking your fingers and using the heel of your palms to press down hard and fast in the center of the chest. Your hands could save a life.